My name's Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our BC COVID-19 briefing for Thursday, July the 9th. Wanted to acknowledge we're on the territory of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nations. Tomorrow, Friday, we'll be providing a written briefing with updates on COVID-19 in British Columbia. On Monday, we'll also be providing a written briefing on COVID-19 in British Columbia. Our briefings next week will be Tuesday at 3 o'clock, our in-person briefings, and Thursday at 3 o'clock. And on Wednesday, there will also be a written briefing. And with that, I'd like to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So today, for our COVID-19 update, we have 20 new people who have tested positive for COVID-19 here in British Columbia, bringing our total to 3,028 people in BC who are positive. Starting today, however, we also will be reporting cases as we have been, by the health authority where people live, but we've pulled out the residents of people who were tested positive here in British Columbia who are residents in another country. And it's just a way of making sure that we understand the impact on our on the population here and the impact of travel and other people who are coming into British Columbia during this pandemic. So that includes particularly visitors who were here and became ill whilst they were here, as well as people like our temporary foreign workers who are here. So with that change, our numbers have changed slightly. We now have 982 people from the Vancouver Coastal Health Region, 1,596 people from the Fraser Health Region, 133 in the Vancouver Island Health Region, 201 people who live in the Interior Health Region, and 65 people in the Northern Health Region, as well as 51 people whose residence is outside of Canada. We have no new healthcare outbreaks, but we continue to have 2 long-term care and 1 acute care outbreaks that we are managing at this time, for a total of 639 cases, 393 residents, and 246 staff who have been affected. We have no active community outbreaks. However, as we know, there have been a number of exposure events where people who have had symptoms or tested positive for COVID-19 have been in a number of public places. And we know, following the confirmation of a second case of COVID-19, Vancouver Coastal teams have expanded their alert for anyone who may have been at the number 5 Orange nightclub on July 1st, but also July 3rd, 4th, and 7th. If you have been at one of the locations with a community exposure event, we are asking you to monitor yourself carefully for symptoms, to limit your contact with others for the 14 days from that exposure, and contact 811 to arrange for testing if you develop any symptoms or have concerns at all. We now have 175 active cases in the province, of whom 17 people are in hospital, 4 of whom are in critical care or ICU. We have no new deaths to report today, bringing our total remains at 186 people. 2,667 people have now fully recovered in the province. As we know, people in British Columbia have done what we've needed to do to flatten our COVID-19 curve. We've put a lot of effort in for allowing this to happen, and I thank everybody in BC for doing their part. I know some people may be thinking this is all over and that they can relax and go back to normal. But until effective treatment or a vaccine is available, we know that this virus is going to circulate in our communities, and it is all of us who need to work together to minimize that, to minimize the impact, so that we can continue to open up activities. And we know that we've seen elsewhere around the world, including in the United States and other places, that things can quickly escalate once again if we let our guard down too far. We have to keep the virus low and slow over the next coming months. We need to do this by minimizing the number of cases that we have, and all of us play a part in that. and in public health, managing every single case, making sure that we have all of the tools we need to find people quickly and completely, and then modify our activities as we need to make sure that we're keeping the lid on things. As you know, we've been trying to find that fine balance of opening up as much as we can, both for our social health, our physical health, and our economic health in the province. Every day we learn more about this virus and the precautions that we need to take to keep things in that fine balance. And we've talked about with the modeling that we're somewhere around 65% of where we used to be in terms of contacts. And that's the balance we need to keep to make sure that we can control this virus and make sure it's not going to spread rapidly in our communities, affecting our families and our province. We know as well that what we call the reproductive number, we want it to be under 1, which means we don't want people to be transmitting to others. As our understanding grows, we'll continue to adjust our guidelines, as we have been doing for restaurants, as we will now be doing around exposures that we've had in nightclubs, for example. We're going to review those guidance to make sure that we have protections in place for employees as well as for customers in these locations. But all of us need to do our part. If we are going to a nightclub, if we are going to a restaurant, recognize that those precautions that we have in place, so smaller numbers, making sure that our group is less than 6 so that we're not putting staff at risk, we're not crowding places, we're not going and mixing in those places with people that we may not know and may not be able to contact afterwards. So we also are working on guidance for many other activities that are important that we want to be able to increase in our communities. And one of those, for example, is for guidance for choirs. I've been receiving quite a lot of questions and concerns about singing and about how can we do that safely. And we have been doing a detailed literature review, and we'll be coming out with some recommendations on how to do that safely in the coming days. We hope to have that available early next week so that we can start some of these other important activities that keep us going through these times of crises. In addition to what we've been doing so far, we're also adopting new tools and new technologies as they become available, because the evidence is clear. The more layers of protection we have, the better we are able to open up and to continue going in our communities. We all have a role to play in contact tracing, to minimize and manage new cases in BC and support the public health teams who are taking care of us. And the things that we can do today that we need to continue to do with contact tracing are to pause and think about our own personal risk assessment when we're planning our activities. Pay attention to where we're going and who we see each day, keeping those really close connections small. Leading by example and following the foundational rules for safe interactions that we all know here in BC now. So that's keeping our contacts small, maintaining our safe distances, cleaning our hands regularly, making sure that if we're feeling at all ill, that we stay away from others. We know as well that this virus spreads rapidly in situations where we're having close contact, enclosed spaces, so indoors where poor ventilation, where there's lots of people. So what we're calling the 3 C's, so close contact, closed spaces, and crowds. And we need to minimize those and make sure that we're taking the actions so that we don't allow this virus to spread quickly. So let's stay ahead of our COVID-19 pandemic here and ensure we don't give the virus a chance to surge. Through our own personal efforts and actions, we all protect our own communities, our elders and seniors, and our loved ones. So let's be united in our efforts, continue to stand together by staying apart, and to continue also to be kind, to be calm, and to be safe.
Thank you very much, Dr. Henry. There were, and we're very thankful for this, of course, no deaths to report from COVID-19 today, but we know that yesterday when we provided a written report, 3 people had passed away at at Holy Family in Vancouver Coastal Health, and of course run by Providence Healthcare, and we're thinking of those families today and the 186 people who've passed away from COVID-19 since the beginning of the pandemic. Their grief and what they're going through is something that I know Dr. Henry and I reflect on every day. I know people in BC are reflecting on as well, and our hearts are with them as they go through this period of pandemic with the particular sorrow that comes from losing a loved one from COVID-19. Our thoughts also go to the people at our sites that have declared outbreaks, all of them, Maple Hill, of course, Mission Memorial Hospital, and in particular, Holy Family, who's going through a very challenging and difficult time. We're thinking of the staff there, we're thinking of the families, and of course, of the residents in all of those care homes. Earlier today, Mary Ellen Turpel-Lafont laid out the terms of reference for the Addressing Racism investigation that she's undertaking. I think you saw from that presentation the terms of reference that are very clear and indicate both her intention to deal with some of the specific issues raised and systemic issues, which I think is very important. I strongly support, obviously, and those terms of reference that have been given to that review. I think all of us are also impressed by the strong team that's also been put in place, which should build confidence, and I think we've seen this in the response. I know I've received in my consultations to Dr. Turpel-Lafont's appointment, and of course I encourage people, Indigenous people in BC, to respond to the survey, the confidential survey by the office, and they can get to that by going to engage.gov.bc.ca /addressing racism. They can also contact the independent team there at accessing_racism at gov.bc.ca, or calling 1-800-600-3078. I encourage people to get involved. This is obviously, in my view, an area where action is absolutely required. There has been a lot achieved, particularly in all the work that's happened with COVID-19, with the First Nations health authorities and with Indigenous communities, but clearly more action is required. And that action, while it may be hard and challenging for all of us to address racism, is necessary, and it will make our healthcare system, for everyone involved, better and safer if these actions are taken. I've been reporting every Thursday on surgery renewal, and wanted to, in BC, as you're aware, on March 16th, we postponed all non-urgent scheduled surgeries while continuing to provide urgent scheduled surgeries and emergency surgeries. From March 16th to May 17th, we completed in that period 23,536 such surgeries, an average of approximately 2,600 surgeries each week. Prior to COVID-19, on average, we performed approximately 6,000 surgeries each week. On May 18th, as you know, we resumed non-urgent scheduled surgeries, delivering them, as well as continuing to perform urgent and emergency surgeries. 40,742 surgeries were completed since surgeries restarted on May 18th. Of those 40,742 surgeries, 31,110 were scheduled surgeries, and 9,632 were unscheduled or emergency surgeries. By health authorities, that's 7,522 since May 18th. In Interior Health through July 5th, 11,599 in Fraser Health, 9,119 in Vancouver Coastal Health, 8,597 in Vancouver Island Health, 2,246 in Northern Health, and 1,659 in the Provincial Health Services Authority. Last week, meaning the week from June 22nd to 28th, we performed 6,911 surgeries. We had reported, when I reported last Thursday, 6,622 completions that week, but the health authorities have restated the previous week's volumes, which led to an additional 289 completions being reported between June 22nd and June 28th, which is, I would say, an extraordinary achievement in terms of the renewal of surgery in BC. This week's report includes the Canada Day statutory holiday, so we expected and in fact have seen the weekly completions to be lower. Last year, just to put this in context, on the Canada Day week, and Canada Day fell on a Monday last year and a Wednesday this year, 5,300 completions were completed that week. This week is past week that included July 1st, 5,259 surgeries were completed. So this is just 41 surgeries lower than the same week last year. This is great progress, especially in the context of pandemic, and especially with the challenges of performing surgeries with the additional guidelines that have been put in place to keep people safe. I also want to note that as of this week, we've contacted 59,420 patients to discuss rescheduling their surgeries. That's an increase of 3,706 from June 28th. And I note through that process, we have removed from waitlist, and this process of contacting and engaging with people on surgeries has allowed us to, as you might expect, to clean up some of the waitlist. 4,173 people have been removed from waitlists, either because they're on twice or their surgeries have been completed and not considered. So this is part of the hands-on effort that's going on. As part of the surgery renewal plan, we said that we would need to do more than just increase surgeries. We would need to shift the way the system does surgery, including how it prioritizes patients, to focus on patients who have the greatest need for surgeries. Two groups identified to prioritize were patients who need surgery within 4 weeks, urgent patients, and non-urgent patients who are waiting more than twice the targeted wait time. Today I can report on early signs of these shifts. For the week of June 7th, a greater percentage of urgent cases were prioritized than last year, about 1.37% higher. This is equivalent to about 95 more urgent cases per week, or 4,000, if this is carried out over the year, 4,940 cases over 52 weeks. In our plan, we said that we'd be focused most on caring for those patients who need surgery, and this speaks to that. I want to express my gratitude to everybody who's delivering on the surgical renewal commitment and the work we're all doing to stop the spread that's making it possible. This is your success and their success as well. I just want to note the week of July the 20th, we'll be providing our first monthly report on surgery renewal. I'll be joined at that time by Michael Marchbank, who is helping us lead this effort, who is doing an excellent job to provide some more detailed briefing on surgeries at that time. We're also committed, and I apologize for taking a little bit more time than usual, to an update on visiting and long-term care. On June 30th, as you know, we announced the easing of some restrictions for visitors at long-term care facilities and seniors' assisted living residences. We recognized, of course, at that time the hardship of being apart from our loved ones, particularly in difficult times. And so I just wanted to note of the facilities in place in BC that we have currently got 61 facilities. Their obligation was to provide safety plans to health authorities, and so far, as of yesterday, 61 facilities had put those safety plans in place. I'll be reporting that's 3 in Vancouver Coastal, 18 in Fraser Health, 18 in Vancouver Island Health, 4 in Interior Health, and 18 in Northern Health. And we'll be updating this next week when we expect the larger bolus of safety plans to be in place. Finally, in closing, I want to thank all British Columbians for their efforts to stop the spread. We had a huge task in front of us when COVID-19 came to our province. We had to learn and practice new skills. We had to manage our lives differently. We had to continually adapt to stop the spread of COVID-19. We have pulled together, we've made sacrifices, and we continue to show humility in doing the job that must be done to keep us all safe. Our BC position today is born of leadership, and that is leadership not just from health officials, from the provincial health officer, from our health officers around BC, from people in the Ministry of Health and all the health professionals and healthcare workers, but from all of you. And we are deeply appreciative. We know that British Columbia exists in a world where COVID-19 is more active than ever. We know the jurisdictions that we all are conscious of in the United States have had their highest and worst days in terms of deaths from COVID-19 today, right now, and right here. We know that we have to continue to make this effort, our collective leadership, all of us and all of you, has brought us to this point where we are, but we have to keep going. Our collective leadership will continue to see us through this weekend that's coming and all the days and months ahead. By staying 100% committed to stopping the spread, we will make this summer, where we're renewing surgery and we're renewing visits and we're working together, a summer that we can be proud of and a summer where we continue to fight the spread of COVID-19. Aujourd'hui, nous annonçons 20 nouveaux cas qui ont testé positifs pour COVID-19 pour un total de 3028 cas en Colombie-Britannique. Il n'y a aucun nouveau décès lié au COVID-19 pour un total de 186 décès en Colombie-Britannique. Nous continuons à offrir nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 17 personnes sont actuellement hospitalisées, dont 4 en soins intensifs. Les autres personnes dont le test de dépistage était positif sont en isolement à leur domicile. À ce jour, 2667 personnes dont le test de dépistage de COVID-19 était positif sont maintenant rétablies. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press *1 to enter the queue. Please also take your phones off mute. You will not be audible until I call your name. As a reminder, you are limited to one question and one follow-up only. First question today is from Vaughn Palmer, Vancouver Sun.
Good day, Dr. Henry. 3 months ago, you talked to us about the importance of antibody testing. I'm just wondering where we stand on doing that now and what the province has learned from it so far.
Yeah, so we are still, there's a couple of things. We have started a number of the protocols, the research protocols that we had approved early on and have in place, and will present next week some of the data from that. It has been analyzed. As I've mentioned a few times, the challenge has been that the validity of the tests is difficult, and we've seen that across the country and in other countries as well. So the false positive rate and the false negative rate can be very high, and when your prevalence, so the number of people who truly have it in the population, is low, that can make a real difference. So what we've had to do is use more than one test to validate every positive, and so that has added a considerable extra time to it. But the two protocols that we've started, that are the first part of it has been completed, is protocols using what we call prenatal bloods, so people who donate blood or give blood on a regular basis for other reasons, and so it's anonymous. It's not we don't know who those individuals are, but it gives us a sense on a population level how many people have antibodies in their blood. So that is one of the ones that we've done a test from bloods that were taken early on in February, I believe it was, or early March, and a second sample that were taken in April or in June. And we've done the same thing with community-based sampling by age stratification, so 1,000 samples from March and 1,000 samples from the end of May. So the other thing, of course, that is why it takes so long is it takes several weeks for you to develop antibodies after you've become infected that are detectable. So there is a lag period for us to understand this. So that's why we had to wait until May or June before we had enough. And we'll be doing another sample on that. So I'll be presenting some of that next week, hopefully on Thursday next week. And the bottom line from what I've seen so far is that it reflects what we have seen here in British Columbia, that very few people have become affected at a population level. But I'll have the more details soon.
Do you have a follow-up, Vaughn?
Yes, I wanted to ask again about second wave. When we got the modeling in the spring, where you explained why the healthcare system was being adapted for the possibilities of to prevent it from being overwhelmed by the outbreak, the modeling at that time was based on what had happened in Italy and some other places. Again, looking to the fall and the possibility of a second wave there, how will you proceed on the modeling? What will you be looking at to decide how many resources need to be put aside, how much in terms of ICU beds and regular beds and ventilators need to be ready for the possibility of a second wave? What will go into the model for the fall?
Yeah, so we were using the experience in other places because we had not had experience here. So what we are using now is the attack rates that we have seen in our population around the province, the types of populations where we know this can be affected, so we're actually using our own data to develop our scenarios for going into the fall. And we have a couple of contingency scenarios that we're looking at, and what the whole plan is around not only preparing the healthcare system, but preparing our own across the board in the health system is making sure that we don't ever have to go back to shutting everything down like we did in March. So when I talk about the dynamic compartmental modeling that shows us needing to be at a balance about 65% of our contacts, that's what we need to continue for the fall into next year until we either have an effective treatment or a vaccine. So all of our modeling is looking at, okay, if we start to see increases in growth in our population of the virus and we start to see outbreaks happening, what are the populations, the age groups, what are the chances of what percentage of people we are seeing go into hospital, go into ICU? How do we make sure that now we know how to cohort so that specific hospitals can take on the burden, and then we can scale up to more if needed. Hopefully we know so much now about being able to control these outbreaks and control the spread in the community that we won't need to shut down all hospitals, and that we won't need to stop things like surgeries and decant people out of the hospitals the way that we did in March to prepare this time. So we can provide all of the details, but that's essentially what we're using now is our own data, our own experience based on our population and the number of ICU beds and hospital beds that we have in the province now. Of course, really closely tied to that is our ability to have PPE and the right PPE in the right place at the right time. So all of those coordination pieces at the provincial level continue as well.
Next question is from Richard Zussman, Global News.
Dr. Henry, I'm wondering if you can clarify the rules around if an essential worker comes from outside of the country, most likely the United States, what are the policies in British Columbia for what that essential worker can do? As in, if they're traveling in a truck, can they stay in Canada overnight without quarantine and go to a restaurant or go to out to another type of business while they're on a break from their essential work?
Yeah, so it's a bit of a balancing act. And when we were all staying home and avoiding going out, at that point in time, we asked essential workers to do the same thing. So it's very similar now. When essential workers are coming back and forth, particularly we know we're asking them to take measures where they're going to avoid contact as much as possible. And we know that they need to be monitoring themselves for symptoms, so we ask them to reduce their contact with others in the community, but also to take those measures that we're all taking now, the public health measures that we have in place. So reducing numbers of contacts, minimizing the going into a situation that's crowded, making sure you're keeping your safe distances, wearing a mask when you can't do that, and most importantly, monitoring actively every day for symptoms themselves, and if they are a contact of somebody who tests positive in the place that they've come from, then they need to self-isolate and stay away from others, and if they develop symptoms to get tested. So it's as we have transitioned, we are allowing those essential workers, most of them, to do the same things that we're doing, but to minimize their contacts, particularly to make sure that they're not going into crowded places. I will say as well that it varies a little bit, because we know, for example, essential healthcare workers who are coming back from working in the U.S. or there's sometimes very few reasons now, but there are reasons why some people are coming back. We often will not let them go back into a healthcare situation because of the risks inherent in that situation until they've completed their 14-day quarantine period, unless it's absolutely essential.
Do you have a follow-up, Richard?
I do. For Minister Dix, unrelated, but to something you spoke about earlier around the terms of reference that we now have for the investigation. Can you ensure British Columbians that you'll commit to all the recommendations that are put forward by Mary-Ellen Turpel-Lafont? And how can you expect healthcare workers to feel comfortable coming forward to speak without health authorities having that whistleblower protection?
Well, I think Mary-Ellen Turpel-Lafont dealt with issues around privacy, and those are obviously considerations, and you see those in the terms of reference, so those are important. And about the intention of her review and what the review will represent. This is something we're going to act on. No one should be under any question about that. That the decision to appoint someone of Dr. Turpel-Lafont's qualities, of her determination, of her ability, I think, to get to what is fundamental in issues, and then the team that she's put around her and the engagement with British Columbians, we intend to act. It is true that we have been acting, and there's been some significant progress made, I think, particularly in the context of the COVID-19 pandemic. But this report will be acted on. That is essential, that is important, and that's something, and that is why we are asking, in particular, Indigenous people across British Columbia, but also health professionals to engage with this so that we can make our healthcare system better and safer for everybody. And that is what this is about. Addressing racism is good for everybody, and making the system better and safer will be good for everyone as well.
Next question is from Hina Alam, Canadian Press.
Hi, Dr. Henry. I was wondering about people. Are you at all worried about how many untested people with COVID might be going around in the community? Is there a way to find out that number? And what do you think that that's a possibility at all?
So, untested people, are you talking about contacts of people, or are we talking about people who are essential workers, for example, who are coming back into the community? Because we are testing, we have a very low threshold for testing. Anybody who has any of the 13 symptoms can get a test anywhere in the province. I know there has been some delays in Interior Health recently, just related to a difficulty with one of the machines, but that has been solved. So for the most part, testing is widely available within 24 hours for people, anybody who has a symptom. And then we are also doing testing of groups of people who may have been exposed to somebody who tests positive, whether they have symptoms or not. And that's based on public health follow-up of close contacts. And we know that in some situations, people may not even, may not show symptoms, but need to be tested. Things like some of the workplaces that we've been had outbreaks in, long-term care homes, for example, where staff and residents are tested. So I'm not sure if that answers your question.
Do you have a follow-up, Hina? Okay. Moving on to Moira Witten, Tai.
Hi, good afternoon, Dr. Henry. My question today is actually to you and Minister Dix about we heard today about Mary-Ellen Turpel-Lafon's investigation, and she was very clear that action on anti-racism doesn't need to wait until she brings her report. And so I know that there is a lot of this work ongoing in the healthcare system, but since this investigation has been launched, what are you doing differently to address the reality of systemic racism in healthcare within the ministry?
Yeah, well, I'll let the minister talk about the ministry.
I think one example that we can point to is how the COVID-19 pandemic has been dealt with. At the beginning in January, when we formed our emergency response team that was chaired by our Deputy Minister, Stephen Brown, and by Dr. Henry, all the health authorities, including the First Nations health authorities, were involved at every meeting, at every turn. In fact, one of the strengths of our response in BC has been the work that has been done between Indigenous communities and health authorities, both the First Nations Health Authority and the Ministry of Health. And that is because it has involved at a leadership level, at every turn, Indigenous people. And I think that's essential and important. You are quite right that we do not have to wait to take action, and we have been are also, and you will expect to see in the coming weeks, action taken consistent with our commitments to addressing racism in the healthcare system. You'll see those actions taken, and there are teams that work both within the Ministry of Health, within the health authorities, and representatives of Indigenous peoples, both in the health authorities, the First Nations Health Council, and the First Nations Health Authorities, and Métis people and others who are going to be involved in these efforts. So significant efforts have been made up to now, and I think some progress has been made on some elements of this, but we also have to take action to demonstrate what Mary-Ellen Turpel-Lafon said earlier today, that people should feel that they can use the healthcare system, that they should come to the emergency room, and we also have to show steps to show that we're going to respond to that in this period while the report is going on, and we will.
Do you have a follow-up, Moira?
I do, thank you. This is more for Dr. Henry, but I'm hearing from an individual on one of the Gulf Islands who's concerned. She's had a couple of symptoms of COVID, but hasn't made the trip, I believe, to Victoria to be tested, or at least to Vancouver Island. And I'm wondering if there's plans to expand testing availability in the Gulf Islands, as it seems right now individuals do need to travel to Victoria or to Vancouver Island.
Yeah, I'm actually believe there is some availability on some of the Gulf Islands, but it is a challenge to have it available everywhere. I know the testing can be done in the islands. I actually don't know exactly which island they're on and where the testing is available, but I know it is quite widespread. The actual test itself, the lab where it is done, for the most part means the sample has to come to Vancouver Island. But I do believe there is testing available. There's sites available that it can be done on most of the Gulf Islands, but perhaps not all of them.
Next question is from Marcella Bernardo, News 1130. Marcella,
Marcella's line appears to have disconnected.
Okay, we'll move on. Cindy Harnett, Times Colonist.
Oh, thank you so much. Families with loved ones in long-term care are telling me that they're glad to have the visits returned, but they're too short and too few, like 45 minutes every 2 weeks, for instance. The biggest problem is not the social time, but the belief that they need to provide care and oversight. So I was wondering, Dr. Henry, would you be able to tell me what are the problems in long-term care that the pandemic has exposed, and what still needs addressing?
Yeah, this is a very broad question. Let me just start by saying, this is a start for the visits. We need to get people into a safe way of doing it and into a routine of doing it. So we do expect visits will be more frequent, and that we'll be able to hopefully have more people as we go through this. But it is important for us all to remember that it is keeping people safe in those communal living environments that is incredibly important. And what this pandemic has absolutely exposed is the vulnerabilities in many of our long-term care homes. So we know, for example, that there's been challenges in staffing, there's been challenges in housekeeping, there's been challenges around aging infrastructure, and all of those can compound depending on the facility. So visiting is an important part of what we need to do to keep our the mental health as well as the physical health of our seniors in care. However, it needs to be done in a measured fashion so that we're not introducing this virus into a care home again. And we just have to look at Holy Family. We have to look at some of the, from Lynn Valley to today, the devastation that can happen if it gets into long-term care homes. So I'm not sure that answers the question, but I'll let you talk to that too.
Yeah, I think with respect to the visits, we would hope to expand it. I think what we're trying to do in every area is to be methodical, obviously to work with the care homes to ensure that they build out a capacity to receive visitors that's safe, and so that's what's happening. And so I understand that people may be concerned now that we're having visits that they're not sufficient for them, and we're going to try and reach out and expand that. But it is absolutely essential that that be done in a safe way, and that'll continue to happen. I think with respect to long-term care generally, as you know, there was a major report on long-term care in 2012. There have been reports by the Seniors Advocate in 2016 and in January of this year. I think, as you know, in 2012, it highlighted staffing issues in long-term care at that time, and I think one of the actions that has been taken is to move to the provincial standard of 3.36 on average. At the end of this year, we'll have done that, which I think is a considerable achievement. As you know, a huge number of care homes, 75 of them, were dramatically below standard, under 2.9 hours per resident day. There's no care homes under 3.0, which is I think a significant achievement. But there are things left to do, significant things left to do. For example, there is increasing demand for care homes, and you're going to see, I think, in the coming weeks and months, action on that in different health authorities in particular. Our existing stock of care homes, this is particularly the health authority owned and operated ones, have not had a lot of renovation or replacement for a couple of decades now. And so we need to see some action then. And we need to fundamentally increase and find a new generation of healthcare workers and increase the number of healthcare workers we have, particularly people providing direct care to residents because they find real support. And finally, I think, and this is a real challenge, this has been the fundamental challenge for us in addition to the safety of residents during the time of COVID, is ensuring that people are able to, within the limits of being in long-term care, which generally means significant physical limits at the very least, that we have to allow people to live life. And this has been the profound contradiction. It's why restoring visits was so important to us. But we have to continue to work so that the experience isn't just about extending life, but living life even within the limits that exist in long-term care to the full. And we've got to keep doing a better job. I think we've made significant progress in doing some of these things with some of the actions taken before and during the pandemic, but there is a lot of work left to do. And everybody who understands and knows and works in the system or visits loved ones in the system understands that.
Do you have a follow-up, Cindy?
Yes, thank you very much for that. I wonder if, realistically speaking, I know there might be some expansion of the visits in August. Are we looking at it like until we have a vaccine that families could return to the bedside of, and for extended day-long stays with those in long-term care? Are we looking till, for like another year or 18 months before that will likely happen?
It's hard to say. We are learning every day about how to do this better. We're learning about how we can do this safely, and we'll push it as much as we can. But if we start to see increased transmission in the community, we start to see seeding of care homes, then we'll need to balance that. So I don't really have an answer for that yet. Obviously, we want to have the minimum that is sustainable for that period of time, for maybe a year, and that's what we're planning for. But if things go as well as we hope, we'll be able to expand that. But I can't predict. The one thing that continues to humble us is watching what's happening when we think we know what we're dealing with, and then the virus explodes in different areas. So we are doing it in the most cautious way that we can, knowing that these are the situations where it can be absolutely tragic if the virus is introduced.
Next question is from Alana Shepard, Glacier Media.
Hi, Dr. Henry. Thank you so much for taking my call. I'm just calling to ask about the outdoor spaces mass gatherings. I know that the BC Wildlife Park in Kamloops has reopened, and right now it can have 1,000 people in it at a time. We're just wondering what constitutes a mass gathering and why there's certain exceptions for places like that when you can't have a drive-in theater with more than 50 cars.
Yeah, so I don't know that specific facility and what their plan is and how it was reviewed. But there is difference between events where people go for a period of time in one area versus, for example, going to a grocery store or a hardware store that's quite large, where people are in and out. They're not with each other gathering and doing specific things. So it is confusing, I know, and we're revising our guidance to try and make that clearer. But it doesn't generally apply to where you have small groups of people doing things in specific settings. However, all of those, if we think of restaurants, for example, we are still restricting to small numbers of people, so 6 is a maximum, maintaining physical distancing or barriers to ensure that we're not having exposure events to those 6 people, but also to the staff and the environment. So it really is on a case-by-case basis how those things are applied, but there's a fundamental difference between people coming together for a specific thing versus small groups of people coming in and out, like in the store or a restaurant.
Do you have a follow-up?
I do. So the Playland is going to be opening at the Peony this Friday, and I'm just wondering if there's going to be any special protocol in place. They've stated that you have to make reservations in advance, but will there be more than 50 people?
So that again is another, it's not an event, it is a facility, and yes, there are absolutely special precautions in place, and I know they've been working closely with both WorkSafe and Vancouver Coastal to make sure that it is small groups of people, as you say, reservations, contact information, limitations on who can be where at a certain time, and the numbers of people are like you would expect, that are allowing those measures to be put in place safely.
We have time for one more question. For any reporters that didn't get to ask a question, there will be a statement released this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the provincial health officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Ethan Sawyer, CBC.
Hi there. Questions for Dr. Henry. Dr. Tam has just announced that she is taking her own advice and taking some time off to recharge this summer. Just wondering if you plan on doing the same, and if so, when, and who will be covering for you while you are on vacation.
Well, it just so happens I am taking tomorrow and Monday off. So yes, I am. That's why we're not having our next in-person briefing until Tuesday next week. I will be available. I'm not going outside. I'm experiencing BC as we've suggested that others do as well. And I do have my Deputy Provincial Health Officer, Rika Gustafson at the BC CDC, as well as Brian Emerson, who works in my office, who will be covering if anything comes up, but I am also very much available. So we'll be checking the numbers and making sure our statement tomorrow comes out.
Do you have a follow-up, Ethan?
Yeah, same question for Minister Dix, and hoping he can give us an answer in English and French.
I was going to suggest, Ethan, for many of our French viewers that I'm going to spend a holiday working on my French, but for the moment, as you know, the legislature is sitting in BC, and so I'm going to be there in question period, and we have I think 3 lengthy days of health budget estimates coming up, and all the work we're doing. And I think it reflects, I think, the answer that Dr. Henry gave to the first question that we received today. This is the time now, the time in July and August, where we prepare for the months to come. The resources are put in place, and so this is, in some ways, this July is the busiest of all the months that we've had so far. We are going to take, I may take a little bit of a break after the legislative session, which is, I think, goes through into the middle of August, and so I might take a little bit of time off. But right now, we're kind of just working our way through it. I hope Dr. Henry will as well, and like her, we have an outstanding team. Like we get to brief and engage with you and with people every day. But I think the whole team at the Ministry of Health, led by our Deputy Minister Stephen Brown, and the whole team there, the team in the health authorities, the team in the First Nations health authorities, the team of health officers everywhere has just been working in exceptional ways, extraordinary ways, doing extraordinary things. And because some of their greatest successes have been outbreaks that didn't happen, we can't highlight those as much, but they've done an extraordinary job. We've got a lot of work to do. To remind everybody, the pandemic is still on. There's no cure and there's no vaccine. And our ability to continue to do surgeries, continue to see loved ones, continue to open up the economy depends on our willingness to follow what Dr. Henry has shown us works in BC, and all of her colleagues and all the people in public health. So wherever I am in the summer, I'm going to keep working in my own life and working in everyone else to make sure that our collective success continues. En français, je veux dire qu'il y a bien sûr une session législative qui va durer jusqu'au mi-août. Donc, je vais être ici à Victoria pendant la semaine et puis à Vancouver pendant les week-ends. On travaille, on fait des promenades régulièrement au Renfrew Collingwood avec ma femme Renée Saclecard. Donc, vous pouvez me voir là-bas souvent et j'espère qu'on va avoir des opportunités de renouveler nos énergies, mais il faut dire qu'on est en pleine pandémie actuellement et il faut continuer. Merci beaucoup. Thank you very much. À la prochaine fois.
Thank you.